So today we are going to be discussing more specifically chiropractic because with all the recovery tips and tricks that we give, all of it comes from the framework of chiropractic. With that, it's always going to come back to neurology. It's in the framework of thinking about what is neurologically going on with this patient. So we're going to discuss a little bit about the Gonstead method and why we use that here in the office, kind of how that really helps, especially with athletes, but also us normies, us normal people.
Or mere mortals or regular human.
Yeah, so how that kind of stands out and really helps with the recovery process because the nervous system is the governing body of the body. Whatever it says, everything else does. If it's neurologically impaired or if it is that communication is messed up, our body is not going to heal properly. Or at least heal in the way that we're wanting to, or the way that we were designed to.
Yeah, chiropractic, that is my favorite thing to talk about, and specifically Gonstead Chiropractic. So we're going to start today. I have my little Gonstead chapters book. Now, this is just a textbook reference book to how to do the things that we do. So there's a couple of little quick things that I just want to read to you because we are more specific than generalized chiropractic, and it's in our mission or our goal to be more specific. But these are also things that I tell my patients a lot of times in different ways and to help educate them and let them understand that we're going to approach things differently than probably any of their other experiences with chiropractors and why. And if we can explain to them why we're doing it, they understand the reasons behind it and they can get down with it. Been in lots of scenarios where somebody just did something to you. They told you to look to the left and they got you on the right or whatever without really explaining much. In the chapters here, it says the Gonstead system. It is a system of meticulously analyzing the patient and on the basis of all the information acquired, deciding what corrective steps to take. So this is not an our idea type of a deal. This is what we can find, what we can prove, and other Gonstead practitioners should be able to find the same thing, adjust the same way to get the same results. It says that it is scientific exactness, its untraumatic effect on the patient, and its predictability of prompt results. So scientific exactness, right? I think the profession of chiropractic gets muddied sometimes because in schools, they tend to shy away from things called science or medicine because of old dogma, because way back when medical doctors and chiropractors didn't seem to see eye to eye on a lot of things. And so there was this kind of dichotomy or this rift that happened. But what we do is scientific exactness. What we do is all medically relevant. There are medical journals, there are neuro journals, orthopedic journals, PT journals all over the world that show what we do with this method and its exactness does help with patients with a whole myriad of issues, not just back pain, headaches, and neck pain, but systemic issues as well. And so we lean into science. We want to know that it's not a my idea, but it's a what's happening to you. And if I can understand what's happening to your body and your nervous system, I can apply the protocols that have been handed down for years and years and years. And just as a quick add-on, when I first got to the world of chiropractic as a patient, I didn't understand that there was many methods of chiropractic. I just figured we're all chiropractors. And that's not true. Just like in the medical community, they have specialties. In the realm of chiropractic, there are just as many methods of chiropractic in which how to approach the spine and the joints. The Gonstead method just happens to be the gold standard. And I'm not saying that just because that's what I do and what I teach. I'm saying it because it's factually true. And you know as well as I do, the amount of work that we have to put in just to get semi-proficient by the time we're out of school is enormous. I mean, it's like going to a doctorate program and then also at the same time being in another doctorate program. And so the whole thing that makes us very unique is we're a biomechanically foundational chiropractic method that is steeped in the neurology of the body and how it operates. And we really look into the disc as the cause of a lot of the problems when it comes to spinal related, neurologically related issues. And why that is because, and again, I'm going to read right from this so I don't screw it up. The entire basis for the Gonstead methodology evolves around the intervertebral disc. The doctor must fully understand, and I mean fully understand, the role the disc plays in a vertebral subluxation. It is the analysis of the disc and the changes it undergoes that gives the most reliable information for locating the potential subluxation. Okay, so let's first talk about the big buzzword subluxation. In a medical community, subluxation means you have dislocated a joint, right? My elbow is out, my shoulder is out, knee is out, something like that, rib is out. In the chiropractic community, a spinal subluxation is a microluxation. It is where a spinal joint has moved to the point when a joint cannot come back to its normal juxtaposition and move appropriately. There should be a certain range of motion. And when you can't get that range of motion back, we start to see damage and results to the disc. We also start to see the effect on the neurology, as well as the blood flow to the disc and the surrounding areas as well. So it is our determination to understand fully what is happening at that joint, what's happening at that disc, and what else can then be affected. In general, we have 5 lumbar segments. We have 12 thoracic, and we have 7 cervical. And it's like a big 24-story building. And in between each is this intervertebral disc. And every one of those discs is there for mobility, but also stability. And as long as those joints are working properly, can take care of its own. It will stay as healthy as it can, given the load that you put under it or the life that you lead. When there is a problem with that, the disc itself can no longer maintain a good position. It can't maintain a good blood flow. It can't maintain a good nervous flow. So you're going to start to see some damage or some degeneration. And then wherever the neurology leads from that segment, now if it's C7, we're talking about potential shoulder issues, or we're talking about numbness into our hands, weakness into our hands, pins and needles into our fingers, breathing issues. That could be heart palpitations. It could be a slow heart rate. You could have thyroid issues. You could have issues with swallowing. You could have some GERD-like type of symptoms. Wherever those nerves go to, and if they're not properly functioning, there's going to be a cause and effect. There's going to be a dysfunction going on. And normally when we're talking neurology, it's going to send out messages either too fast or too slow. And so you can have things speed up too much. You can have things slow down too much. And there are problems with both aspects of that. But really, the Gonstead method is different than all other chiropractic methods in the sense that we are specific probably to a fault. We really take the time to figure out what your problem is, where your problem is. We want to accept where we find it. We want to fix it, and we want to leave you alone so you can heal. And the accepting part is you can have a person that has migraines or headaches, and those could be derived from a problem in your pelvis or tailbone, or even in your thoracic spine. It doesn't necessarily have to be in the head because that's where you hurt. Just like low back pain can be derived from a problem at the upper cervical aspect where your head and your spine meet, and not actually down in your low back where you might feel it. Symptomology is kind of transient. When we're chasing symptoms, and that's not something we do. We find and we analyze the root cause, and we fix the root cause, and then we leave you alone. Because the healing process of the natural healing process of the body happens when you're not doing stuff to the body. It happens in between, just like at night when we're sleeping, we recover. Our brain recovers, our body recovers. Well, you're not working at night while you're sleeping. You're not eating. You're not doing it. All you're doing is recovering. And so in between chiropractic adjustments, whatever type of chiropractic you go to or have had, the healing comes in between. And you can maximize that healing by getting some specific adjustments at the right spot at the right time and not overdoing it on your nervous system. And you can heal very quickly, or you can see the stuff on YouTube and crack you like a glow stick. And, you might feel okay when it happens because you're having an endorphin dump from the neurological insult that you just had, depending on what they do. And then you're right back at it. The headaches come back, the back pain comes back, the constipation comes back, the fertility issue, whatever it might be. It kind of comes back. And it's because you don't find the root cause problem. And when you do find the root cause problem, if you're specific and gentle about it and you're perfect in your positioning, everything heals quickly. You don't have a lot of issues. You can heal up quick, even though, we say it to our patients all the time, I'm going to get the most for you by doing the least to you. And we're talking about the nervous system and how that heals for that.
Yeah. And especially when you're on the correct segment, when you're on the correct portion of that segment, because that's how specific we want to be, you were talking about,
right.
And then what direction does that need to be? It's as much pressure as you would put on your eyeball before it hurts.
Yeah, absolutely.
It's not much.
And it should, if you're perfect in your positioning, the pressure that you would push on your eye is enough to realign that segment, remove the interference, help the disc restore itself back to its original juxtaposition, give the range of motion it needs back. So you're increasing the health of the disc, and you're taking the pressure off the neurology and blood flow that sprouts out from the spinal cord through the nerve root out to all parts of the body, wherever it may be.
And when we're talking about juxtaposition for that segment to realign, we've both read plenty of commentary as far as that softness that we're talking about isn't enough to realign the spine. First of all, you only know that by looking at x-rays pre and post.
I would also argue x-rays, motion palpating those segments as well.
Yeah. And we're talking about millimeters, right?
Yeah. Oh, yeah.
And
yeah.
Very, 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 very small. And it doesn't seem like that would cause that big of a thing, because it's like, oh, we're sitting here. Is this sitting here going to cause us a subluxation? Well, if you do it long enough, and it's usually micro traumas, so small traumas, right, like sitting in a bad position for a long period of time, or macro traumas are bigger impact.
Car wreck, fell down the stairs, slip and fall.
Yeah. But it's an accumulation of both. And we don't know unless we actually put all of that criteria together.
So let's talk a little bit about the protocol, right? There are 5 main steps that every Gonstead doctor should be taking every time they see a patient. So before they decide what they're going to adjust on you that day, they should be using some type of instrumentation. The instrumentation is usually a heat sensing or temperature sensing device, medical grade. I always describe it to people like it's like old guys at the beach with their metal detector. It doesn't necessarily tell you it's a ring or a soda can. It's just something metal, and you should look here. We're looking for segmental inflammation. If there is a joint out of place and it's putting pressure on the disc, which is then putting pressure on the nervous system, nerve root, spinal cord, etc., the soft tissue, the muscles that are around that hold those segments together, you're going to have one side that's a little hotter than the other. Now, you can have an actual root cause problem, have that, but you can also have a compensation. When you're looking at x-rays, for instance, and you see some really gnarly stuff, or the segment that moves too well, that's a compensation. It doesn't necessarily need to be adjusted. It means that something is working more than it should, and so therefore it's wearing down faster than it should. We're looking for a root cause subluxation. This would be like you've taken a turn in your car and you bumped a curb. No big deal. Everybody does it, although my wife says she never does it. And I would believe her, because she never fibs to me about it. But so you bump a curb, no problem. Well, a couple of days later, maybe a week later, you realize that when you let go of the steering wheel a little bit, although don't let go of the steering wheel, the car starts to drift over a little, and it keeps on getting worse and keeps on getting worse. And so you take your car in to get your car fixed, and they say, okay, well, it needs an alignment. If you do the alignment and you don't change the tires, but the tires have started to worn down on the edges because of that drift, that out of alignment, the car, once the alignment is realigned, will drive straighter for a little bit, but that curve or that pull is going to come back because of the tires being worn down. Just like on the other end of that coin, you can go and get brand new tires, no problem. And they'll drive straighter for a little while. But if you don't fix the alignment, the underlying cause, all of a sudden, you're going to start to see wear and tear on the tires. And the alignment is the major. If that's not fixed, I don't care how many sets of tires you put on there, it's going to wear down quickly and it's not going to be great. But you have to identify, once you've figured out it's the alignment I need, now I also need to do something about the tires so that they're working in conjunction. And so instrumentation helps us to find segmental inflammation. Now, the second step is going to be static palpation. So static palpation, we will palpate the areas around the spine, the muscle tissue, both in the laminal gutters, both sides of your spine. And we're looking for abnormalities. I just made that word up. Abnormalities or
abnormalities. Oh my gosh. Yeah. Neither one of us can talk.
We just join those two words together. Static palpation, we're feeling for the tissues. We're feeling for swelling or edema. We're looking for skin changes like pitting edema, red marks on the skin, maybe tufts of hair or maybe acne or other types of things that are out there. Also part of visualization.
Yeah.
And we're looking for, does everything feel the same right to left at these areas that might be a problem? Motion palpation, we're going to take those static palpation findings. So maybe we find a little swelling at one or two of those segments that we find, and maybe there's some skin redness at one of them. Well, we're going to take those joints and we're going to motion them and we're going to move them around. And I don't mean global motion. I'm not ripping people all over the office. I'm not bending them fully forward or fully back or twisting them around. This is segmental motion. So millimeters. We're going back to the tiny little millimeter movement. And we're going to compare that motion of that suspected joint to the joints directly above it and below it. And we want to get a good idea of how it's moving in conjunction to the joints directly around it. Because a true spinal subluxation will not move the way it should, where compensations will move too well. We have a listing system in this method that gives us like our language to identify where the problem is and what the problem is, and then apply the protocol to fix those problems. And so after we've motion palpated and maybe we find the one isn't moving correctly, we want to know in 3 accesses, 3 different degrees of motion, how it's not moving. I want to know in the X, Y, and Z axis.
Three-dimensionally.
Three-dimensionally. And so our listing system is 3-dimensional. Everybody has heard the term a slipped disc. The truth of that is the disc doesn't slip. The bone slides slightly off of the disc in such a position that it is no longer square onto the disc. The disc is a ring-like structure made up of many layers, oblique layers, concentrically, with a nucleus, or like we could call it a liquid ball bearing in the center. And the weight of it should sit directly in the center of it through the vertebra. If the segment slips backwards, there are little fibers that grow into the bony end plate called Sharpie fibers, and it kind of resembles a cogwheels lined together. Well, if the bone gets stuck out of place for micro reasons, macro reasons, any host of reasons, it kind of jumps a tooth, so to speak. And now that level disc is wedged open. And now we can't get that range of motion we should. We can't pull in good fluid and nutrients around that disc. We can't certainly push out the bad stuff. And we start to see general decay of the disc and damage to the disc and the annular fibers of that disc. Because if we're putting our body weight or different forces, and it's supposed to be nice and parallel and held there, and now we're talking about some posteriority at the very least, we have more forces in certain areas of that disc than others, and it's going to overtax it. It's kind of like taking a water balloon and squeezing it, and it bulges out the side, right? The pressure of my hand isn't all the way around the water balloon. Otherwise it wouldn't bulge out.
Or maybe I'm just hungry, but also the analogy of a jelly donut. Right. So like if you have a jelly donut, it is filled with jelly, and the outside is the actual pastry portion. If you were to bite into that jelly donut, that's one section gets squeezed down. You're damaging the outside first, and then the jelly portion is being squeezed the other
opposite
direction.
way.
Right. So
causing an imbalance.
I did also want to ask, so you're referring to the disc, right? And so that would be like your second cervical vertebra all the way down to L5. What about the segments that don't have a disc? What about them being subluxated?
Right. So they can be, and there's a full listing system that we'll get into about those. To finish up in the regular intervertebral discs, we want, again, 3 dimensions of motion. It gives us the idea or the protocol. If it's stuck over to the left posterior, it's wedged up on the left, and it's rotated to the left, I know the setup that I need to do to course correct that and set that bone back squarely onto the disc, returning it to its natural juxtaposition so the disc is now more parallel, has a better range of motion, and can take care of itself and start the healing process. It also takes the excessive pressure off of the damaged annular fibers of the disc. The jelly donut, right? When it's squeezed down one way, it's going to push in the other way. We need to kind of suck that back in and get all the things. There are a couple other joints that don't have the normalized or the regular intervertebral disc. Your skull to C1 is one of those segments, C1 to C2 as well. And then you have the SI joints, the sacroiliac joints, how our pelvis moves. So there are protocols with all those things as far as what the normal range of motion should look like, what it actually does move like. And then we start to look at these rules, right? And so the pelvis, for instance, just because of my injury, I have a keen sense of knowing all things about the lumbopelvic spine. When you have 2 sides of the pelvis, they're called iliums, and you have the center tailbone, which is the sacrum, that moves in something called coupled motion. Now, for a very long time, it was taught that when you turn 16 to 18, your tailbone fuses. There's no more moving parts. And Dr. Gonstead, this is one of the things that kind of made him famous. He would work all weekend with cadavers, and he would dissect them, and he would put a lot of his theories into practice. How does this move? Is it really fused? All these other things. And what he found was the sacroiliac joints are very mobile, although the bones aren't smooth. They're kind of convoluted. They're kind of crunchy, so they can get stuck a little easier. The sacral segments, now the sacrum itself is a triangular-like bone. It's usually made up of about 5 to 6 segments plus a coccyx. There are sacral segmental disc spaces throughout that. Now, they are tiny discs, not as big as the intervertebral discs, not as free moving, but there is a range of motion that can happen in all of these. And we have plenty of X-ray evidence here. I have seen for years and years, I've seen all kinds of X-ray evidence, and Dr. Gonstead found that those sacral segments have a limited range of motion, but can be stuck out of place. And the neurology that comes out of your tailbone, both internal, the front side of you, and external, the back side of you, is so neurology rich that even small subluxations, even small fixations in the sacrum can lead to a whole host of different problems. It can be digestive things. It could be fertility things. It can be urinary tract things. It can cause headaches and migraines. It can cause all different types of things. You have a lot of neurology that comes out of that area. And not only is it supplying all of the lower part of your body, but it's supplying all of your lower part of your abdominal organs. It has its claws, so to speak, into a lot of different parts of working parts of your body, for sure. So when your kid is learning how to walk, the first time the baby starts to walk or tries to walk, chances are that baby is going to fall down.
Yeah.
Where do they fall? They fall on their butt. When they do start to walk, they're constantly falling. If you live anywhere up north during this time of the year, slip and fall on the ice. If you play a sport that happens to be slippery, like hockey, for instance, how many times do you think you fall on your butt? And so all of those impacts over time can cause these problems to be here. But a lot of us, we don't think, hey, I've fallen on my butt a million times. Maybe there's something to do with my digestion.
Yeah,
I don't think that.
That would not be my first thought
No,
at all.
No. And so what happens is you say, I have some digestive issues all of a sudden.
Yeah.
Well, maybe, is it all of a sudden, or has it been kind of leading up this whole time? And now it's just so big of an issue that you're like, oh, it's all of a sudden. And you go in and they take a look at you and they say, no, I can't find anything. Let's do a colonoscopy. No, I can't find anything. Let's do a couple of scans. No, I can't find anything. Well, try this medicine or try that or try this. None of it's working. I don't know. I can't find anything wrong with you. Maybe it's in your head.
Yeah.
And I think that's kind of a disservice too, because now you're telling me I don't know enough about my own body that I'm wrong, but I'm telling you I have an issue, right? So there's a lot of things that, and when patients are here, we have the nerve charts everywhere. I just had this conversation the other day. A lady was in with her son. He's an athlete, school-age athlete. And she was saying, he's growing up. He's had issues with sport-induced asthma, breathing issues, and he's always had an inhaler. Even though we came here for something entirely different, he doesn't necessarily need his inhaler anymore.
Yeah.
And I just noticed the other day, we haven't refilled it, and I don't exactly understand why that is. And I take him over to the nerve chart and I say, okay, well, I'm finding an issue here and I'm finding an issue here. Now this one, let's trace it and let's see where those nerves go to. We'll look at that. They go to your diaphragm, they go to your lungs. So by correcting those things, just getting the interference out of the range of motion in the musculoskeletal system and taking the pressure off the nervous system and the blood flow to those areas is enough to restore regular body function and the ability to heal, And does this happen every case? No, it doesn't happen every case. But I will tell you, it's a non-invasive way of making sure your nervous system and musculoskeletal system work correctly. Nobody has ever argued the point that said properly functioning nervous system is a detriment to the way that I live. That's not how that happens. When we make sure the nervous system, this stuff is out of the way and it's working properly, if you still have issues, maybe digestion, maybe breathing, maybe fertility, maybe whatever, we've checked off the easy stuff. And now your specialist for that, fertility doctors or whatever, can really start to dive in and investigate what's the real cause, because we know it's not musculoskeletal. And it's certainly not neurological from that aspect. So what's going on here? So we can help the MDs and the specialists out there by saying, hey, we've checked all of this stuff, and now you can get in your wheelhouse and figure out what's going on here. Or a lot of times we can help those that they're having patients come in and they're not getting anywhere and they can't find any problems. They do refer them to us. And when we take a look at them, a lot of times we can help reduce or resolve a lot of those issues because it was a musculoskeletal imbalance because of a spinal subluxation that affected the neurology, that affected the thing. And we were able to untie that knot. And so if I have to work with an ortho or a neuro or a gastroenterologist or a podiatrist, any of those things, I will work hand in glove with those people. And we will work together so that we get the patient better by working together. I will not sit there and say, well, they shouldn't prescribe you drugs because they don't know what they're looking for. Just like they shouldn't say, you shouldn't go see those people because they're a bunch of quacks. There are good and bad in every profession, and you should do your own due diligence to figure out who good and bad is. We have our own ideas, and we have our own standards or measurements that we like to do. And so We went over instrumentation, static palpation, motion palpation, visualization. Again, this goes on the whole time, right? I'm watching from the moment my patient comes in. How are they walking? How are they sitting down? How are they standing up? How are they presenting? High shoulder, head tilt, pelvic imbalance, toe in, toe out. Are their ankle or their foot dropped in on the one side? Does it look like they're walking funny on their just generalized gait? I'm looking at all of it. I want to see any indifferences because it all gives me some pieces. We have to have a lot of these arrows pointing at the one thing before we say, okay, this is what it is.
And that's also how it's scientific, right?
That's right.
Going through the scientific method, at first you have like your hypothesis. You have a question that you're investigating. That'd be like a patient presenting. And then you formulate some sort of objective test that you're going to do.
Yep.
You find that out. Okay, what does that give you? And then you go through the rest of the steps. And if you don't have those objective measurements, and let's say they're subjectives, their pain, their point tenderness, their whatever, their perception of how they're living, if that doesn't correlate with what you think you are finding, then how does that all make sense? Right. You have to have as much data as possible in order to figure out, oh, there is some sort of objective improvement, and this is why things are changing or are not changing.
Yeah. We want to measure and remeasure. We want to justifiably have tools in our toolbox that allow us to find the problem, fix the problem, and know when we fix the problem so we can leave them alone. X-ray analysis is the last step of the 5 steps of the Gonstead method. And X-ray analysis is fantastic. I don't think a lot of people, I think more people should do it. I know right now there's a big push in the chiropractic community that, why do you need X-rays? I don't think that you need X-rays. I would argue that you definitely do. I tell patients all the time, I'm not going to guess with your health. So I'm not going to certainly guess with what we're doing to you. And since we're affecting your nervous system, I got to know what type of condition you've gotten yourself into in the inside. And X-rays also give me really good information on where is the root cause of the problem? How is it stuck? Does it confirm my findings? And then how it's part of the measurements that we take after the fact. I saw something post recently, and it talked about how chiropractic doesn't change posture and doesn't change alignment. And someday we'll get into this. And if you have more questions about different things like that or other type of methods, leave us a message and we'll dig into it and we'll look it up and we can talk about it.
Drop us a comment.
But I will tell you that from doing this for a very long time and all the other chiropractors that have come before me, all the way down to Dr. Gonstead, we analyze and we mark, meaning we put lines and numbers and measurements all over our X-rays because we want to see objectable measures and we want to see a change. And so we want to see disc height growing. We want to see better proper alignment. We want to see the pelvis being more aligned than it had been. And all of those things should correlate with a better functioning person. Their quality of life is better. Maybe their subjective stuff like pain has been decreased or their range of motion has increased. But we should have our tests that show us that we're doing right. They should correlate with how the patient is feeling and how the patient is healing, right? And this is, I know we're talking a lot about this, the analysis stuff. You know this as I teach. I say this all the time. When I was in school, I said this ad nauseum. If you can't find the problem, the root cause problem, and I don't care what type of healthcare professional you are. I don't care if you're a PT. I don't care if you're an MD. I don't care if you're a DC. I don't care if you're a DO. I don't care what it is that you do. If you're a healthcare professional and you can't find the root cause, the problem, you can't find the problem on the person to help that person overcome that problem, you are the problem if you are now doing something to the patient to see, right? And so we have to do all of these things every time we see a patient. I don't care if it's my first day with my patient or my 150th day with my patient. I'm going to do these same 5 steps every time because it can change. It is a specific misalignment that we can, if we can find it and we can get over the target, we can help to correct it. And then again, we should see all the objective and subjective measures increasing or improving. And so when we do X-ray analysis, we do X-ray analysis. And I'm not trying to blow our own horn or anything. We work with a bunch of local orthos and neuros. There's one group, fantastic group, wonderful doctors out here, and we share patients all the time. A couple of years ago, I had a patient that had come in, and this patient was already scheduled, but was going to be getting a pain implant for some low back pain they've had chronically for a very long time. Mm-hmm. And so a pain implant, how that normally works is your ortho or neuro will put in a temporary feed. Now, the pain implant is like an electrical current kind of, that overrides the pain signal to the brain. And so you're not getting the signal. It doesn't do very much about fixing the cause, but it does stop the communication between the brain and the body. And therefore the pain level or sensitivity, the subjective pain, is decreased. But they start with the temporary. And if that works for the patient, then they will go and implant the permanent, right? And so this patient was scheduled for the temporary and had been referred in here. And so I said, what I say to all my patients, we'll see. Let's see what we got. So we did the full analysis. We took the full spine x-rays. I did all the analysis. I did the palpation. I did the instrumentation. I looked at everything. I did the objective measures. I did all the ortho and neuro testing. And I started to treat the patient. And if I remember, because this was a bunch of years ago, I believe it was a right pelvis was the major. And there was a secondary compensating that turned into a major that was a little higher up in the mid thoracics. And so I saw this patient for, I think it was only 4 weeks, maybe. So I saw them just a handful of times. They were feeling better range of motion. Subjective was great. Objective tests were marking improvement, which was fantastic. And I said, okay, well, you're about to go and get this. Normally when you have a procedure like that, I am now second fiddle to the person that's doing it, to the ortho or to the neuro. So if and when they clear you and you need to come back to see me, I'm happy to help. And then I did another thing that I always do to all my patients that we share with other doctors. I handed them a disc with their x-rays on there with the full analysis. And I told them, I'm going to give this to you and I want you to give it to your doctor, but don't be upset if that doctor says, oh, this is from your chiropractor, and tosses it to the side. Because there's lots of good and bad in all professions. And unfortunately, a lot of the MDs have only heard or seen, maybe not the greatest examples of chiropractic, just like a lot of chiropractors have seen, maybe not the greatest examples of MDs, whatever. So I just told them, just so you're aware, it's no skin off my nose, but if they don't want to look at it, great. But here it is, just in case they do. I didn't hear from them for a couple of days. I think it was maybe 10 days later or something. And the CA at the time called me. I was back with a patient and she said, hey, this doctor is on the phone and wants to talk to you about this patient. And I get on the phone and I said, this is Dr. Gormley, what's going on? I said, well, I wanted to talk to you about the x-rays that you sent over. And I said, sure. What do you want?
Like, what's wrong?
Right. That's, in my head, I'm like, what's going on with the patient?
Oh, no.
And I said, are they doing okay? And they said, oh, they're actually doing fantastic. But who did these x-rays? And I said, who did them? What do you mean? Well, who took them? And I said, oh, I did. And she, oh, okay. And there was a little bit of a pause. And then she said, no offense, but, and I laughed and I said, you didn't realize that a chiropractor knew about x-rays. And she goes, kinda. And I go, I get that, I get that sometimes. And she goes, okay, but then let me ask you this, you took them, but where did you send them to for this analysis? And I said, oh, you mean like the lines and numbers that were on them? And she said, yeah. And she said, yeah, exactly. And I said, I did them. And she said, huh. And there was another pause and I go, let me guess, you didn't know that chiropractors knew how to not only take x-rays, but look at x-rays and analyze x-rays. Yeah, sure. And she kind of laughed and she said, I'm so sorry. I don't mean to be rude, but yeah, kind of. And I said, yeah, no, I did them. Why? I said, do you have any questions about it? Or you want some explanation? Or is there a problem with them or something? And she goes, no, I'm sorry. I used your x-rays to place the temporary because that's how good they are. And I said, I'm sorry, what did you say? And she said, yeah, I had your x-rays up. Now, I also used some other things too, but I had your x-rays up because they were so detailed that I could place them exactly where I wanted it, the electrode to go.
Yeah.
And I said, well, great. I'm glad. And she said, do you do this for other people sometimes? And I said, well, that's not yes, I do them for all my patients. But if you're asking, would I do them for your patients? I'm happy to do that. But my patients come first. If I'm busy all day, I will get to them for sure. But yeah, in the event that you want me to do that, you just call and have the patient call here and schedule the appointment and we'll take them in and I'll just do x-rays if that's all you want. Yeah. I'll do the analysis. I'll send everything back to you and we'll go from there. And she said, okay. And the past couple of years, there's probably almost 24 times that group has sent patients over for x-ray analysis. And a lot of them also come in for chiropractic care after that because they feel maybe, I don't want to say safer, but they feel more assured.
Yeah.
Because their neuro was like, hey, I'm going to send you to this person. Great when it comes to x-ray analysis. I want them to take x-rays and do the analysis. And if you are looking for chiropractic care, I would recommend.
Yeah.
And so this is a big part of the Gonstead method. I think anytime that you're looking at x-rays, current x-rays, and I'm going to say standing x-rays, when you're in an injury or an accident maybe, or you go to the hospital and they take an x-ray, normally, depending on what's happening to you or where they're taking the x-rays, they're laying you down.
Yeah.
And what happens when we lay down, happens every night when we lay down, everything in our spine kind of opens up a little, And so I can't tell you how many times I've seen x-ray reports from whatever hospital, and it says no sufficient findings.
Yeah.
I stand them up, and those discs that are injured can't sustain that gravitational load. And so you're going to see right away, there's the problem. All of the 5 steps are very important because it leads us to how we're going to correct the person. But x-ray analysis is one of the more underrated ones. Those are the 5 basic steps, right? We have instrumentation, static palpation, motion palpation, visualization, although that happens the whole time, and x-ray analysis. Those 5 things have to point to one thing to tell us what's wrong and then how to do it, right? Yeah. And those 5 things, those answers with our listing system and knowing exactly where the problem is, then we have a whole system to apply to that problem, because you might have let's call it an L5 disc problem, and I might have an L5 disc problem, but they need to be treated completely differently because you are you and I am me. And so there is a method of chiropractic called diversified, just like the definition diversification. You're diverse, you're many things. This is taking a little bit of a lot of the methods and kind of are putting them together. It's more like a shotgun blast, right? There's usually little to no x-rays or analysis. They're going to lay you down on your side, and it doesn't matter what side. And they start by rolling and popping your hip. They call it a lumbar roll, right? And they make a big crack in your lumbar spine or your pelvis. They flip you over, so you're laying on your opposite side now. And they do the same thing. So they twist and pop you. Then they put your face down and they go up your back, and they usually put their hands, called prayer hands, but they put their hands together, or they're just indiscriminately pressing into your back, and they're making pops as they go up. And then they flip you over. So now you're looking up, and they twist your neck and they pop it one way, and they twist your neck and they pop it the other way. Sometimes they'll flip you back over and they raise up your feet and they say, see, your feet are level. We did something. I'm not saying they didn't do anything. And I'm certainly not here to say this is good, bad, or indifferent, but I am going to say that that's the same type of or group of manipulations that every person that walks into those offices get. But then you come in right after me with a totally different, you have migraines, I have low back pain. Yeah. You get the same flying 7. And then your wife comes in and she has digestive issues. She gets the same flying 7. Everybody gets the same every time, right? Every time you come in. And there's not a lot of change that'll happen. Maybe you feel good for a little bit. Maybe you feel good for a day or so, but then it's coming right back in. And that's where the belief that, hey, once I start going to a chiropractor, I'm going to have to go for the rest of my life comes in. And really the idea with the Gonstead method is we want to find your problem. We want to accept where we find it. We want to fix it. We want to leave you alone. We want you to live your life 80 to 90% of the time your way. If you're sore or stiff or whatever, you can ice it, heat it, stretch it, do the things, the tools that we gave you. It's the times that you can't fix it, and or it's getting worse, or it's affecting other things. Your body's trying to tell you, you should come in and see somebody that's maybe a little more specific. And so when we have our analysis done and we know that, and again, we're doing this to you every time. Yeah. You come in today, you come in next month, you come in a year from now, we're doing these 5 steps. And then based on the results of those, we're going to identify the issues, and we're going to apply our method of chiropractic, our ability to be very gentle and very specific to correct just the issue you need. Mm-hmm. And often it blows our patients away because they will come in and maybe it's just wellness. They're feeling pretty good, but they come in every month just in case. And I will check them and I'll say, you're good today. Go forth and be good. And they're like, what do you mean? You're not going to adjust me today? Your body doesn't need it. And so I'm not going to do something to you that you don't absolutely need. I want to do the least to you to get the most for you.
Yeah.
And I'm going to do it in such a manner that it's very safe, it's very repeatable, and it is something that, again, is not my idea. I would implore you to ask my wife. She'll tell you I don't have good ideas a lot of times. So it shouldn't be my idea, and it shouldn't be your idea, and it shouldn't be, any doctor's idea. We should be measuring and we should be finding out the problem. But I can speak to the Gonstead method because that's how I got fixed. So going from a traumatic back injury where I couldn't use my right leg for a very long time to not having any pain or issues or range of motion or mobility issues to where I feel much better now than I did way back then. It worked for me. And that's what it was, is I accidentally, literally found a Gonstead doctor that understood the problem, found the problem, fixed the problem, and then left me alone to heal. And that blew me away to the point where I was like, okay, I'm going to go and do this thing. And his advice, which thank God he gave me that advice, was your first day going to school, get involved with the Gonstead community, because you're going to practice. You're going to practice till you can't see straight, and you're going to think you suck at it. And you're going to have to work harder than you've ever worked in your life. But when you get proficient at it, when you get finally good at it enough to help somebody, when somebody walks in with a very serious problem in their eyes and you can help them right away and they see the results right away, you become something different to them. You know, I have one of our great patients. I love them to death, but the whole family, the matriarch came in years ago, and she woke up one day with facial drooping, Bell's palsy. And they are a family that doesn't lean into a lot of medicine. They're more natural, which is fantastic. I mean, I'm married to a pharmacist, a clinical pharmacist. Both my parents are retired nurses. I know there's a lot of importance in the medical community and in pharmacology, but there's a time and place for it, just like with chiropractic, time and place for it. So her husband and her came in, and she was besides herself, and because she had gone to a med place like an urgent care or something, and they said, oh, Bell's palsy, it's a virus. It could take 6 months to a year to resolve. And so this lady's thinking like she's going to have this facial paralysis and these other issues for a very long time. And to be honest, I don't know how she found us. And so she came into us, and I went through the Gonstead protocol, right? And the nice thing is a new doctor, for students out there and new doctors out there, it's scary. When you first have these patients come in.
Yeah, especially a legitimate problem.
That's what I'm saying. This lady came in, and I was a new doctor at the time, newish doctor at the time, and she has facial paralysis, right? And I know from my training with the Gonstead community, from teaching, from all those things, that we can help with this, that sometimes it is a virus, but sometimes it is not a virus. Sometimes it's compression on the cortical tracts in the spinal canal, right? On the spinal cord itself. And so, although I wasn't shaking on the outside, I was nice and calm. I'm shaking on the inside because I was like, oh my God, I've never had this type of, I've had the back pain, neck pain, headaches, standard stuff, but this was the first, gut check, the pucker effect. Yes. It was the pucker effect was on, let me tell you. And so I did all of my analysis. I went through all the 5 steps. I calmed myself down. I studied everything. So I found that this patient, her Atlas C1 was misaligned. Now she had some other things too. But as far as the primary culprit, I found that Atlas was misaligned in a particular way. And so I used that analysis to determine that. And then I used my skill set that I learned on how to set up on it or how to approach that to free that joint up, to take the pressure off the neurology. And that's all I did. And I said, okay, we're just going to do this today. And I'm going to send you home. And I want you to just relax for the next couple of days. And I want you to come in like 3-4 days. And let's recheck it. Let's see if there's any improvement. And there may not be. Okay. And I prepped her, hey, this may help a little and it may not help, right? We'll see. But she was pretty positive it wasn't a virus, as I did as well. And so she came in. She didn't wait 3 days, as a matter of fact. The next day, I was just about ready to leave. And she walks in with her husband. And the husband has tears in his eyes. And I look at her. And she doesn't have facial paralysis. Now, there was still a little bit of like maybe drooping underneath the eye a little bit or whatever, but like she was smiling, a full smile, know? And I said, oh, I see that we've got some good results from that. And she burst into tears. He burst into tears. I burst into tears. We're all crying together. Ugly sight. But we're all crying together. And she was just very, very thankful. And when I was asking her afterwards, getting to know them, she had seen a Gonstead provider. They were from up north in her hometown a long time ago. And when they moved down here, that's the only type of chiropractor they knew of. Yeah. So unlike me, where I went to everybody and anything and tried everything until I accidentally found one, she knew and she looked up. She was comfortable in the fact that she had prior experience with other Gonstead doctors. And so she knew the tenets of if I'm a Gonstead doctor and I'm down here and you're a Gonstead doctor and you're way up there, we should be able to find basically the same things. We should be adjusting it basically the same way and to get the same results. Yeah. Because we are all, again, just like in the medical community. And I love the medical community. I'm not a chiropractor that does not love them. I do love them, but they are the premier, I want to say, healthcare medically wise because of all of their standards and protocols. Back in the turn of the century, if you had a headache, they thought you had demons, so they would drill a hole in your head and it would release the demons. Well, they don't think that anymore, right? So over the years, they've kind of retooled themselves, and even to get into medical school, it's kind of a big jump. You have to do some stuff, just like with chiropractic school. You can't be a doctor just because one day you thought, oh, I think that might be cool. But their standards and protocols are such that they have a high standard of care. The Gonstead provider, the Gonstead chiropractor, also has an equally high standard of care, and therefore we get a higher or a better result. There are some referral sites out there. GonsteadSeminars.com, I think, is the better one. There's a couple of them out there. You can find your local Gonstead doctor as close to you as possible. The reason I like GonsteadSeminars.com is the Gonstead Seminars is the seminar series of the Gonstead method that Dr. Gonstead himself started and is still going on. And I want to say, gosh, I mean, that's the one that we work with and go to all the time. I think there's been something like 940 some seminars since Dr. Gonstead started it. And we keep it true to what he taught. Yeah. We don't inflect our ideas or our opinions. It's only what we've found to be true and repeatable. Yeah. And so that method or that group or that organization is the original. And their referral on their website, their referral page, I like because it will tell you who the doctor is, how many seminars they've been to, and when was the last time they went. And the big deal for that is if I was in chiropractic school and I decided Gonstead is what I want to do, and then I got out and I never again practiced with any organization or any other group, my skill set, although I don't want it to, is going to slowly decrease over time. I'm not as sharp as I was. There's a lot of really good doctors in there. Don't get me wrong. I am an expert in what I do because of how hard I work at it and how hard I work every day to maintain or get better at that. I'm not a little bit of Gonstead and a little bit of diversified and a little bit of this and a little bit of that. I'm only a Gonstead doctor. And through that lens, that has to come first. And then everything else, the recovery stuff that we do here, my wheelhouse is the Gonstead method, chiropractic, specific chiropractic. Their wheelhouse, their expertise is physical therapy, is sports management, is exercise theory, is neurology, is all orthopedics, all of those other ones, right? And if we all work together for the betterment of the person, that person gets better quicker and stays better longer.
Yeah.
I'm not, and I'm not saying anybody else is either, but just personally, and I know you as well, we are not looking to be everybody's everything.
Yeah.
We're looking to be the very best Gonstead doctor for you, help you as much as we can. And then now let's add some other things that will help enhance the healing, fast forward the healing, or prolong your ability to stay good and not re-injure. Yeah.
Between that, what we discussed before about wanting to work in tandem with people that can help within their own lane, within their scope of practice. None of it is for our glory or for our benefit or for our, oh, look what I did. All of it is for the betterment of the patient.
For sure.
Right.
And that's how it should be.
That's
100%. I say it all the time. Your servant's towel needs to be longer than your ego. I call it the Muhammad Ali effect. Look how great I am.
Yeah. Look at this amazing thing I did. Or
you might be really good.
No.
But if you're really good, you should be more focused in helping people. We are more used to the doctor doesn't talk to you or listen. And it's not generally the doctor's fault, right? It's the HMOs or the insurances that are like churn, or you get dinged. So you need to see X amount of people. And so you don't have the time to be a doctor, because all the doctors I know that are under the gun like that, they want to take the time to talk to you. And so a lot of times we're the first healthcare practitioner. We're the first physician that has ever sat down and listened to them, talked to them, and then tried to come up with solutions that cater to their individual issues.
Yeah. And that stands out.
Absolutely. A couple of years ago now, wonderful family. They've since moved. I miss them to death. But the daughter had some systemic issues, some stuff she was born with. And the mom had taken her into a sleep study. She was not sleeping very well. She was getting a lot of headaches as a young kid. And so she got the sleep study back. And it's in medical speak. It's in medical terminology, the whole thing, right? And so she calls me, gosh, I want to say it was like probably 8:30, 9 o'clock at night or something. And she was in a full panic because she thought she gave her daughter epilepsy. And I was like, okay, calm down. What are we talking about here? What are you referencing? I just got this report in my chart. I'm reading it. And it says, that I think I gave her epilepsy. I said, it can't say that. Okay. I said, take a picture of it and send it to me, or text it to me, or whatever. Let me read this real quick. And so she did. She took a picture of it. She sent it to me. I read through it. And the nice thing about, being a doctor is we can speak doctor. I find that sometimes when doctors refuse to speak people, that's not a great sign, but I like to speak people, but read doctor.
Yeah.
And so I read doctor, and I read in there that one of the tests that they test for was nocturnal epilepsy, which is a standard test that they do in sleep studies, and that she was negative for that. And so this patient saw the word epilepsy and flipped out. So I call her back and, I said, hey, listen, let me read this to you in people speak. And so I translated it. And then she said, oh, well, that doesn't sound so bad. Why do they have to write it that way? I said, well, insurances and other things and, whatever. Yeah, liability. And you want to be, right. But they should come with some type of translation or at least a little note that says, hey, by the way, if you don't know medical terminology, please don't read this and flip out. Right.
Yeah.
But that was something that I was able to do, give her peace of mind right away.
Yeah.
That, if she called the doctor that did the sleep study or her pediatrician primary, she wouldn't have got a hold of him at night. She may not have gotten a hold of him for days to weeks. So she would have been kind of tormenting herself that whole time that she did this to her child, which is not how that works. It's about how can we serve you, the patient, in the way that you need to be served to get the results that will help you with what you have going on. Yeah. And how can we give you some tools and education that better supply you or better suit you for your life going forward. So you'll know what to do, and you'll also know, okay, now I need to call. Now I need to go in because this is happening.
Yeah.
Yeah. So that's my little probably long tirade of Gonstead method and Gonstead Chiropractic. Do your own due diligence. There are great doctors in every field. There are also, unfortunately, many, maybe not the greatest, but that's true in every profession.
Yeah.
I don't care if you're a garbage man. There's nothing wrong with that. I love that, actually. To a doctor, to a chef, I don't care what it is. There's the good and the bad. So you want to find the good for you, and you want to try to avoid the bad.
Yeah. So we obviously are passionate about this, and we wanted to share a little bit more about why that is the framework for all of our recovery, for all of our care for our athletes, for all of our patients. That's the framework that everything else then is spun out of, where everything stems from.
It's the lens that I look at everything through first.
And again, anybody ever has any questions,
message us, put a note in there, email us, call us, whatever, but we'll talk in length for all those fun things. Oh, can I tease this real quick? We got somebody coming in that you're not going to want to miss.
Oh yeah, we have.
All I'm going to say is we have a high-level professional athlete that is wonderful at what he does and as geeky as we are when it comes to neurology.
Yeah,
and we're going to have a great conversation very soon, and we'll have that posted out as well. But that's one I'm really looking forward for.
Yeah, I agree. I love to hear not just testimonials, but again, people that are bought in.
Yeah,
with it.
If it's a professional athlete, often I think we put them on a pedestal, right? But if they don't do a lot of things that we don't do, they can't get there. And this guy is going to blow your socks off with his intelligence, his ability, his background story. I'm real excited.
Yeah. All right. Well, we'll see you guys soon.
Yeah. Talk to you soon.